Thanks, and I'll start by saying just give a talk like everybody did in the first session this morning since they're all great. And so this is an interesting talk on how to give a talk. I'll start with the title slide. Always use the title that you were given to speak about. It's very interesting when you plan sessions where somebody decides to change what they're going to talk about. It makes the moderator upset, and it gets everybody upset. So if you're giving a talk, give that talk. Always put your name on there and put your titles behind your name. Be proud of where you're from. When you're giving talks, especially if you start giving talks in your community, you are actually marketing yourself. And so remember to put your hospital logo on there because they actually tend to pay us these days. So it's important to use your talks when you're giving a talk to highlight who you are, to highlight where you're from, because you are, when you give a talk, representing your institution and yourself. Always have a conflict of interest disclosure slide. Even if you don't have any conflicts, you have to have this slide. And just about everywhere you talk now, you have to have this slide. My conflict actually, and part of our university, since a lot of my patents, if it's my university and my hospital, I have to disclose that my hospital and my university have a conflict of interest disclosure. Also, I put on here if you have a off-label use of a device. You should always list that early on and again later if you show something off-label. That's mostly for CME standards. It's not bad if you have to disclose it, but you should disclose it. And there's basically 3 rules for giving a talk. Keep it simple, clear, direct, and easy to remember. And always repetition is the goal when you're trying to win an argument or give a talk, presenting your data, is tell them what you're going to tell them. That's your introduction. Tell them, argument, and that's your data that you're presenting. And then tell them what you told them, which is the conclusion. That's the basic for all talks that you're giving, especially if you're giving a scientific talk, which is a very brief talk. And be prepared. There's nothing like not knowing your data when you're up here and talking where you have to rethink about it. Obviously, I don't use note cards. Most of the speakers this morning, nobody used note cards. When you're early on, you may use note cards. Remember, if you have a stack of cards and you drop them, you're going to get very anxious and know that you're going to lose track of what you're talking about. So most people that give good talks don't use note cards. And you'll see that, I think, hopefully, unless Dr. Calery might use note cards, I'm not sure later today. But most people talking don't use note cards. The talk. The secret to being a bore is to tell everything. When you're giving a talk, especially a 10 or 15-minute or even grand rounds, is that don't speed up. I mean, if you're the expert of your field and you've spent 15 years researching it, there's no way you can tell everything you know in that 15 minutes or that hour. And if you tell everything, you're boring. And I like these 2 Voltaire quotes here. It's always nice to have a little picture in your talk slides that something ancient, something that I don't know much about because I'm an Ohioan native. I'm not cultured like many of you people on the East Coast are. Remember, a talk is shorter and more constrained than a paper. When you have a paper, and some of the more central surgical or any of the societal meetings where you have a long paper, a paper tends to be about 2,500 words. Most scientific talks are 7 to 10 minutes. That's about 1,000 words. There's no way that you can have everything in your paper in that 7-minute talk. So occasionally you just have to leave out certain things that were in your paper just to make sure that you present on time. And always remember when you're giving a talk, what is the takeaway? What's the key point that you want to give that talk about? And it's really building your message. 2,500 years ago, Aristotle actually had these essential strategies of a talk or an argument. The logos, you have to persuade through reason and fact. You have to have some fact, some basis of what you're going to be presenting. And pathos is actually having something that brings out emotions or triggers something as an audience. That gets the audience involved. Even if you're going to say something like laparoscopic cholecystectomy should never be done, everybody looks up. You have to get some trigger there, or robotic surgery is terrible, and everybody will start yelling at you. Do something to get their emotions striking there. And then you have to have your ethos, which is your credibility as a speaker. And part of that is make sure that what you're talking about has some basis in truth. Your demeanor, your voice, your dress. Most of us will wear a tie up here and be somewhat prepared. And getting your point across and using humor. I always like to say is if you're giving a 7 to 10 minute scientific talk, you don't have time for that humorous slide. When you're giving a grand rounds or something, you have time to at least put in one slide there. But I always like to tell the same thing when my kids were teenagers is, remember, anything you put in the digital world will live forever. And occasionally our residents will have some risque slide in there, and you remember, that may live in the internet forever. So always be careful of what you put in there as your cartoon slide, because it will live on forever. And remember, if you are not funny, if you can't make a joke, and you try to tell a joke on the podium, and you fail, it will be awkward for you and everybody in the audience. So remember, if you're really not funny, don't try it out on the podium. And results, the meat of the talk. Remember, you have to have some evidence, some statistics. It improves your credibility. Documentation of sorts. key charts and graphs. I think, as you saw earlier this morning, some people put in there, I think what most of us, when we're giving a talk now, we kind of take a little screenshot of the article. I think it allows people to know that you have a source. It doesn't make you repeat writing everything down again, because you should source your documents, and it actually works pretty well. If you have a table there's usually on any table only a few key points. Highlight them in red or something, make it out. And I always like to put some photo in there that might actually bring out that emotions in a patient. And remember, if you're using a photo of a patient, make sure you keep a record that you have okay to use their photo. That can always come back and be a problem if you don't have that record for it. Presenting the talk, practicing out loud, be familiar with the podium. The worst thing you have is when somebody comes up to give a talk and they don't know how to move the slides. I mean, in every meeting here, especially in our very rapid scientific meetings where we're giving a talk every 10 minutes, you should have gone up there and know the podium. Look at the audience. You may not be able to see them depending on your talk because of the bright lights coming at you. Hand gestures can be okay. I like Dr. Eubanks this morning. He always uses his left hand. And kind of like a politician, you have to make some point there. People know that. Visual aids are important. And then the boring part of my talk is coming up now, which is the basic PowerPoint. And again, it's important to realize is that the companies that develop PowerPoint spent millions of dollars. They have their default settings. Just use their default settings. I mean, if you try to switch around colors and stuff, it can be a problem. I mean, this will blind anybody. And we've had people just, I'm playing around with the colors, and now I'm pink and yellow and everything. And this gives people seizures in the audience. And again, the people that developed this, they spent millions of dollars. I mean, they know what font size to use. Don't start switching around the fonts. I mean, yeah, it looks neat that you have this unusual fonts can be read too. And remember, most of our PowerPoint talks becomes the handouts. And so you want to make sure that what is in your PowerPoint will be printed usually. And so you want to make sure that you don't have any of those risque pictures in there, some secret inner jokes. Again, it may live on forever in that handout. Again, don't overload the text. And it's always kind of like the 666 rule is that 6 points per slide, 6 words per point, and add some images to keep it interesting. It's important, as most of us all have these pictures that we have. And I think as you start off, and some people are younger here, just get used to having a folder on your computer. If you take a neat photo, you have a neat film clip, put it in a folder. And I have my folder for hernias, my folders for reflux surgeries, my folders for diaphragms, and other things so that you can find them later. The worst thing happens, you have this great photo and I have no idea where it is on your computer. So try to organize those early on in folders that you just keep them there year after year. Remember, smaller images can load quickly, crop the image to size, and it's very interesting now with modern software that you can do all this very easily. Most of us older surgeons remember when we had the old slide carousels where if you made a mistake on the slide, there's no way you're going to redo that beforehand. Videos are important, I think. A little video clip's the key. We all have our own little video clips. This is one of my patients who couldn't skydive on a ventilator, and there's reasons why spinal cord injured patients tend to be young males. And always try your video beforehand. I mean, most times you're giving a talk, it's important to make sure the video works and everything. But the key thing, if the video doesn't work, just go on. When you're in an audience and you have a bunch of talks in that 1 hour time period, there's no video that is so important that the audience needs to see it. If it is, you should dang well make sure it was going to work okay. So never go back and try to fix that video, just go on to the next slide. It's always important to keep your talk and linked files in a folder. Label them with your last name and title so that when you turn it in, it's important. And I always tell my residents is that the key thing you can do with the advent of wireless everything is just email your talk to yourself. That way you always have access to it. You can always download it in case of emergency if they lost it or some computer went down, or put it in the cloud, as we all know. But either emailing it or putting it in the cloud is a good way to at least store that talk when you go somewhere. Always answer questions succinctly, be polite. And this is kind of a pet peeve of mine, is when you're asked a question in a scientific meeting where you have a brief period of time, never try to go back to your slides. It kind of is difficult, perhaps in certain areas where you're giving a longer talk and it's an hour and you leave time for questions, but it's almost impossible to go back to your slides when the question comes up. Just answer that. You should know your data so well, you should have your data memorized that you should be able to recite that slide verbatim up at the podium. Don't try to go back to the slides. Conclusion, simplicity, repetition, preparation, and always end early, especially for those of us that go on the lecture circuit. When you're giving a grand rounds at lunch or something, everybody has somewhere to go at 1 o'clock. Always end early. Always know in case something happens where they were late starting or they had some questions early on, know that you can go to your last slide. because the worst thing you can do, if you go late, everybody's upset with you. It's the worst reviews. We look at speakers. Speaker goes late, everybody's upset. So just end early. Just go to your conclusion slides and be aware if you have 50 slides that you can slip to your conclusion slide and just conclude and be done with it. If you go late, everybody's upset. And always conclude with a thank you.